Oh, by the way, just in case you don't know, my name is Ed Gramlich from the National Income Housing Coalition. And this short session is about the first year of implementation of the National Housing Trust Fund. We're talking about the first year of 2016 uses of this money. The coalition began striving, advocating, and organizing to achieve the National Housing Trust Fund starting in the year 2000. 16 years later, the money started to flow. And that's what this little session is about. It's about the experiences, the best practices, some of the good, the bad, the ugly that people experienced in 2016 when we had $174 million in the trust fund nationally. For 2017, our consultant is guesstimating about $220 million for 2017. For those of you who don't know, and shame on you if you don't know, the National Housing Trust Fund is a dedicated source of money that is intended to build, rehabilitate, preserve, and operate housing that's extremely targeted to extremely low-income people and renter households. In your conference packet, there is a short little booklet called Housing the Lowest Income People. This is my summary, my personal summary, my love notes about the first year of the National Housing Trust. It's not even the first year. This is based on the draft allocation plans that all states in the District of Columbia submitted to HUD that were going. Let me back up. These were the draft allocation plans that were presented to the public so that the public could make comments about the draft allocation plans before states in the District of Columbia submitted an allocation plan to HUD for HUD approval. So on the stage with me are Jenny Sardone, who's the Director of Affordable Housing Programs at HUD, and I've known Jenny since probably 1991. She was a Cub Scout when I met her. She's still quite young and vibrant. And then Ayana Gonzalez from the Massachusetts Department of Housing and Community Development, Chip Halbach, who's the Director of Minnesota Housing Partnerships, and Jim Yates from the Technical Assistance Collaborative. I won't go into a whole lot of detail about their bios because we don't have all that much time. So let's get into it and talk about this brand new program, starting with HUD's experience, how HUD looked at the allocation plans as they came in, and she'll have probably some ideas about some of the issues that HUD was concerned about so that you can learn how to make sure that your state submits a better trust fund allocation plan in 2017. That process is going to start really, really soon. So Jenny, take it away, please. Thank you.
I'm not sure. Is it on? No, I don't think so. Okay, so they're going to turn that on. Can you hear me now? No? Oh, it said you're on. I think I'm
Hello?
on. Yes or no? Okay.
This doesn't count towards your 10 minutes, by the way.
Yes. I get that. That's freebie time. Good afternoon, everybody. It's great to be here. As Ed mentioned, we go back a very, very long way to the days of Chaz. And so if you know what a Chaz is, you're definitely of a certain age. So my office at HUD is the office that for many years now has administered the Home Investment Partnerships Program. And a number of years ago, when HERA passed, we were sort of designated to run the Housing Trust Fund whenever it would be funded. And honestly, for years, I really was of the opinion this program is never going to happen. So we were really pleased, extremely pleased, when finally in December of 2015, Mel Watt, who's the director of the Federal Housing Finance Agency, announced that the GSEs would begin making contributions to the trust fund out of their 2016 business proceeds. So at that point in time, we started ramping up to get ready to finally run this program that had sort of taken on mythical status at HUD. And so we issued a notice on the allocation plans and a template We developed review criteria and got everything ready to sort of do our normal stuff. We did some webinars. In April of 2016, we announced the availability of $174.6 million to be allocated by formula to the 50 states, the District of Columbia, Puerto Rico, and the 4 insular areas, which for those of you who don't know what the 4 insular areas are, that's the U.S. Virgin Islands, the Northern Mariana Islands, Guam, and American Samoa. So, and we announced those formula allocations in the Federal Register on May 5th. So we'll get sort of toward the end of my few minutes, we'll talk about what's going to happen in 2017. But I wanted to talk about sort of the experience that we all jointly had, you know, you as advocates and the states as grantees and HUD as a reviewing entity on the allocation plans. You know, it was a very challenging year, and actually, even though the calendar says April 2017, we're actually still in 2016 in my office because we're not done doing the reviews of the allocation plans that came in. So, you know, we pretty much anticipated that there would be a lot of challenges sort of doing this plan for the first time. And so we sort of came up with a protocol where normally these plans would be reviewed just in the HUD field offices, but we were jointly reviewing them from headquarters as well, just because if mistakes are made in the first year, they tend to get baked in and it's harder to get them out in the future. So we've been involved really since August, pretty much continuously with reviewing these plans. So there was not a single plan that came in that we were able to approve on the first pass. There were a couple, we had a 45-day review period at HUD. There were a couple that had relatively minor issues and we were able to resolve them within that time. All the rest of them had to be disapproved and then sent back to the state. A couple of them were disapproved more than once, and we're still working our way through. As of today, out of the 53 plans that we're expecting to review, 43 have been approved. So if you want, I can read you off the 10 that haven't been approved. People want to hear that? I figured you would. So the plans that we're still working on are Arkansas, California, the District of Columbia, Maryland, Michigan, Rhode Island, Texas, Wyoming, Puerto Rico, and the Virgin Islands. And I should just mention that the 3 other insular areas all ultimately decided to relinquish their grants because the amounts were so small. I mean, in one case, it was a $2,000 grant. I think the biggest one was about $55,000. So they are not taking their money. Virgin Islands, at this point in time, still is intending. So we've obligated 31 grants, and that means that they're set up in the system, and the state can get moving and can start using money. So, you know, I think that you know, part of the challenge that we had this year is that the HTF plan, and this makes sense from an administrative point of view, was incorporated into the 5-year consolidated plan and the 1-year action plan process that we use for other formula grants at HUD. But I think it also created a little bit of an identity crisis for the allocation plan. And you know, I know that we went, you know, we did some webinars and we also did some appearances at conferences, and the message that we were trying to deliver to states was that you know, we didn't expect the HTF allocation plan to be necessarily as detailed as a QAP, but that if you sent us something that sort of only had the level of detail that you would see in an action plan, that would be a problem and, you know, would probably result in disapproval. And that's a lot of what we saw. I think that there was some misjudgment among states about what really HUD was anticipating. And honestly, I think that HUD had a hand in that. We helpfully tried to put this template out to try to make sure that states hit every single point that they were required to hit. And what we ended up was getting sort of them just filling in the template in a very minimal way. So that has, I think, resulted in a lot of the back and forth that we've had to go through with the states. And so because this is part of the action plan, HUD's review standard was substantial completeness. And even though that is not, so it's not a really, it's not heavily into the substance, we were still trying to judge whether or not they had met the requirements of the statute and the regulation in their plan. And so the things that were really tripping people up were sort of among the priority funding factors, geographic distribution. And there were some states that did a really great job of that. But others, I think, didn't really address it or didn't address it in any level of specificity. And we were sympathetic to that because this is, for a lot of states, $3 million. It's very hard to have a lot of geographic distribution of $3 million when you're attempting to serve extremely low-income people. So, we certainly anticipated that there would be problems in that area, and that was true. But, we had some states that, really, I think successfully addressed this just by talking about urban versus rural, talking about sort of the point scheme for different places or the amounts of money that they might anticipate going into different parts of the state. I think the other thing that was, that was a little challenging, and in this respect, I have to say that the report that Ed did was spot on in terms of his review of, congratulations, his write-up of the draft plans, I think was extremely complete. And actually, I took a look at it before we came over here just to make sure I wasn't going to miss anything, because he did a really good job with that. So I think the other area where the states didn't really do what we had anticipated that they would do was merit of the project with respect to state-established priorities. We had a lot of states that seemingly didn't address that at all. So this was sort of us saying, and this was from the statute, wasn't HUD saying you must, address, certain priorities, but you had to have your own priorities. We had plans where they referred to priorities, but they didn't tell us what they were. Where they didn't mention that they had priorities at all. That was always a definite rejection. Or they didn't really tell us sort of how they were going to operationalize sort of this preference, that, I don't want to say preference because that's another thing, but how they were going to sort of recognize the fact that specific projects really were meeting their own priorities. And so all of those things ended up in plans being sent back by HUD. And then, leverage was another area. Most states did address leverage, but they didn't tell us, is there a threshold for leverage? A project had to have a certain amount of leverage in order to be considered. Were they going to have a sliding scale? And then another thing I think that was problematic was the extent to which projects had project-based assistance. And I think, and this is one where I think HUD has to take the blame. I think that the way that we wrote the rule was not really, did not really send the right message. Our concern in having that as a priority was affordability to extremely low-income people. But I think the message that we sent was you had to give more points to projects that had project-based vouchers or some other type of project-based assistance, and that wasn't really what we were intending.
Can you hold on 2 seconds? Because we had to make a quick transition. I wasn't able to inform the rest of the panel that Ellen is our timekeeper.
Yes.
So keep your eyes on Ellen. We're already at your time, but I'm going to take advantage of my sitting here and give Jenny a couple more minutes. Because I think what you were saying is really, really important. And that will also maybe reduce some of the questions that might come from the audience, if that's okay with the rest of the panel.
Thank you.
Okay.
Thank you. And I think I'll be done in a couple minutes.
Okay.
So, so that was the priority funding factors. So, and those were the issues that we had there. Those are probably the things that, as advocates, are of most concern to you. So I suspect when you see final plans, you're going to see some different things in there than what you saw, or a different level of detail than what actually was in the draft, because there was a lot of back and forth on that. The other two areas that tripped people up in a very big way, and I'm not going to address them in detail, but was the rehabilitation standards that were required to be submitted was almost universally across the board a problem for states. And I think more than anything else resulted in a lot of back and forth between the states and HUD, and the maximum per unit subsidy limits. We permitted states to sort of come up with their own, and so it wasn't necessarily the limit that they chose, but the way that they described it or didn't describe it. So what did we really observe beyond what I've already mentioned about these plans? I think, and this makes a lot of sense from the state's point of view, all states are looking to administer their HTF funds as a part of some other funding competition. And that's just a reality of how much money it is. And so that's primarily LIHTC. They want to award their HTF with LIHTC. In some cases, they want to award it with home, or LIHTC home and HTF together. There were only 2 states that considered home ownership at all, and they seemed pretty lukewarm about it. The other states had nothing in their plans that indicated that they would be doing home ownership with HTF. And there were only, at least based upon what was in the plans, only a small handful were considering using HTF for operating subsidies. Although we are beginning to get more phone calls from grantees who, in thinking about their 2017 plans, are considering adding that and have been asking us for some guidance, which we do intend to issue. So just quickly, so I can hand it over to my fellow panelists, what about 2017? Well, we don't have a final amount yet for 2017. I think that the estimate of 219 to 220 million is about right. But we do not have there's a lot of stuff that goes on with those numbers, that we're not even involved in. It happens over at OMB, but they'll take a sequester off the top. They'll add back in last year's sequester. So we don't actually even know exactly what the number will be, but it will be in that neighborhood. So what does that mean? In 2016, there were 35 states that received the minimum $3 million grant. And that meant that the 15 larger states took a real haircut. And in some cases, a couple of cases, like California, they really took a haircut in order to make that minimum. So for most states, there's probably going to be a couple states on the margin who will get a little bit more than $3 million. But for the most part, most of that increase is going to end up going to California, to Texas, to New Jersey, to New York, to Washington, to Oregon, to Illinois. So you can take that to the bank, I think. And then in May, we're going to be launching an IDIS module as part of the Econ Planning Suite. That means that next year's allocation plans will be sort of getting submitted through that portal. And I know that's something that Ed wants to talk to us about, because I'm sure that he's concerned and you all are concerned in being able to see in some kind of consolidated format the elements that are the allocation plan as opposed to other parts of the action plan. So we'll be definitely talking to Ed about that after your conference is over. And then I guess finally, I would just say that we're in a little bit of an interesting situation this year. Last year, and in most years, HTF funds will come out after we have an appropriation and after people know what their home and their CDBG and other monies are. This year, we will be putting out the HTF allocation numbers before we know the appropriated amounts in all likelihood for the other formula programs. And so what that really means is that even if once we publish those allocation amounts, that states will be essentially sitting on their hands, waiting until they get the go-ahead. They're not allowed to submit their action plans until we actually tell them what their formula amount is under their programs. So even though we'll get those numbers out, there's probably going to be a delay in allocation plans being sort of developed and submitted for 2017. So with that, I'll turn it over to Ayana.
All right.
Good.
Am I on? Am I almost on? So my name is Ayana Gonzalez. I'm here from Massachusetts. I wanted to say I'm just really pleased to be sitting on this panel. Thank you so much, Ed, for including me.
Thank you for being here.
Thank you. I'm pleased to be representing Massachusetts and pleased that our Undersecretary for Housing from Massachusetts, Crystal Cornegay, is in the room today. I had to do that. So I'm here to talk to you about our HTF allocation plan in Massachusetts.
And it has nothing to do with the Minnesota slides that you're seeing.
Oh, yeah.
But this will give you plenty of time to
Right.
appreciate the state of Minnesota.
Right. And I want to talk to you about our plan, but in order to do that, I need to tell you like a little bit of history first. So back in 2013, Massachusetts, our state legislature, sort of set aside some money, specifically general funds, to use to develop supportive housing projects. And supportive housing, I'm sure you all know this, is how affordable housing that's paired with supportive services targeted specifically and integrated and delivered together. So in Massachusetts at the time, it was part of a larger initiative around reducing homelessness. And so what we did was we took this money and we paired it at DHCD, our housing agency in Massachusetts. We paired it with state rental assistance, and we have state-supported rental assistance in Massachusetts, which is wonderful. So we paired it with that, and then also we took out of our rental assistance budget, we funded out of it this supportive service stipend, which is sort of a per unit annual stipend that went along with the rental assistance to fund supportive services or service coordination. So we took all of this and we threw it all together into a supportive housing round with some other state funding, state resources, with LIHC equity, and we held, for the first time ever in Massachusetts, one of our nonprofit, this rental round where we put what we like to call in Massachusetts the 3 legs of the stool of supportive housing all in one pot. So it's the capital funds, the operating support, the supportive service funds, all offered together in one competitive round from one source, which was the DHCD. So between 2013 and 2016, we held 3 really successful, actually, competitive funding rounds around supportive housing specifically. And in that time, we funded over 600 units of supportive housing using this model, with everything together in one pot. And it was fabulous. It worked really, really well. And then in 2016, the state funding for the program disappeared, which was very unfortunate. But right then, at the same time, in comes the National Housing Trust Fund. And so at the time when we got access to it, our Undersecretary Crystal, I'm going to call you out again, was adamant from the outset that we use this money specifically for supportive housing. That's what she wanted to do with it, and it made a lot of sense, right? It makes sense because the trust fund, sort of by design and by definition, is targeted to very low income, extremely low income households. These are the folks that we were serving already through our supportive housing development programs, right? These folks that are very vulnerable and really, really need these supports or can benefit from supports to be successful in their housing. So DHCD decided to build on the success of those 3 supportive housing rounds that we had in the past and prioritize supportive housing in our allocation plan for HTF. And so to that end, our allocation plan specified that anyone that applied for the funds needed to come partnered with someone, with an agency or an organization that had access to supportive service funding. So they needed to be partnered with someone that had federal funds, Medicaid funds, or private dollars, or one of our local state health and human service agencies or their partners. But they needed to be partnered with someone that had access to supportive service funds. And our developers in Massachusetts know how to build these partnerships and these relationships because we've been doing this work for a couple years now. So they're good at this, and they came ready to do that. So we also laid out preferences in our plan for homeless families and individuals, for veterans, for elders, for persons with disabilities, and just in general for vulnerable populations that could benefit from supportive housing. So we targeted in a number of ways, in their preferences and in the partnerships that we required. So we released our approved allocation plan. I think we were one of the very few that got ours approved pretty quickly without it being denied the first time. And we did that really because we had an extraordinary amount of technical assistance from our local HUD office. We wouldn't have been able to do it otherwise. And so we put our approved plan out on the street, and we held some info sessions, and then we released a notice of funding opportunity availability. So to augment the HTF money, because it is only $3 million in Massachusetts, the Commonwealth of Massachusetts committed $5 million in sort of special state bond funds that we set up for supportive housing. And then, as we did in our previous supportive housing rounds, we set aside a chunk of state rental assistance, and each one of those rental assistance vouchers came with this $1,500 per unit per year of a supportive service stipend that funds supportive services or service coordination. And all of this went together into our National Housing Trust Fund round. So just this past January, in January of this year, we accepted applications for developers. And I'm getting a warning, so but I'm almost done. So we're already at the application part. So we accepted applications in January. We just last week announced awards for our first 7 projects that are going to receive National Housing Trust funds in Massachusetts. It's really, really exciting. That's a really fabulous group of projects. I can't tell you about all 7 because I just got a time warning. But so one of them is going to build 16 units of affordable housing for families moving directly out of shelter, right? Another one is going to create 35 units of 1-bedroom apartments for these medically compromised frail elders that are at risk of homelessness or institutionalization. It's just a really, really nice group of mission-driven projects and the kind that don't always get scooped up in our LIHCC rounds. So it's great. So let's see. DHCD is supporting these projects with $3.1 million in National Housing Trust Fund dollars, which is really just our total allocation minus the admin. And then also with another $15 million in state-funded affordable housing resources. And then with this project-based rental assistance that we have and the supportive service stipend on top of that. And so it comes back to those 3 legs of the stool, right? It's the capital, it's the operating, it's the supportive services that you put together to really make, to hold up the supportive housing. And that's what we're doing in Massachusetts.
Thank you, Ayana.
Yep.
It's very exciting.
Yeah, it is really exciting. Yeah.
Now can we go to Minnesota?
Let's try. We're back.
All right.
So is this going?
No.
Okay. And so I want to sort of build on that while focusing in on an individual project in an individual community. And so what was it, year 2000 that this all started, Ed? So we had the decades of advocacy, then the suits to force the federal government to get the money from Freddie and Fannie, and then, you know, the shutdown, and then all the rule writing, et cetera, et cetera. So it's so good to now be able to talk about housing in communities, just like you were doing. So I'm going to pick up on that. But also, you know, she left the room, but Sheila Crowley is here, who really gave birth to this effort here. So she's out there somewhere, and let's just recognize this is Sheila's baby. So again, this is all about Minnesota. For you on the coast, we're somewhere in the middle. And the project I'm going to talk about here is the Solace project in the town of St. Peter. And that's why I have the map here, because probably few of you have been to St. Peter. St. Peter is a town that's about 70 miles south of the Twin Cities, and you see that star on the map of Minnesota, and then it has a nice river running through it. It has a cute little liberal arts college in it, town of 11,000, so it's good to see the project here be used in a rural venue, a rural community. Also, it has a regional treatment center in it, which is essentially a prison for people who are sick. So, and we'll come back to that when I talk about this, but it's the oldest regional treatment center in the state of Minnesota. Okay, so if I touch this, something's going to go. Solis Apartments. Here's the site plan. It's 30 apartments here. Let's see if I can. And 1, 2, 3, 4-bedroom apartments. 16 of these apartments are National Housing Trust Fund subsidized with rents below 30. The rest have some home dollars. I'll talk about the overall financial structure in a minute. And it's developed by an organization, Southwest Minnesota Housing Partnership. And that's a nonprofit that really located also in southern Minnesota that does work in Iowa, Minnesota, and does fantastic work in rural communities. But this isn't just about a nonprofit developer doing good housing. This is about a community story here. It's a community that really owned up to its situation here and committed to solving something that was facing a lot of people in their community. And again, this is a community of 11,000. What was going on, as I mentioned, the regional treatment center, a lot of people were being released from that regional treatment center, mental illness and that, and having nowhere to go. And so they were ended up back in, if not the treatment center, in jail, et cetera, et cetera. So it was just a tough thing to see in this small community that so many people were failing and falling by the wayside. And of course, that costs the community a lot too. And if you're in a town of 11,000, your budget isn't all that great. So there was a judge in Nicollet County, where Solis is, who really said, we got to bring the community together to do something about this. So they brought together the probation officers, the defense people, public education, the school district, other mental health providers, and the city government and the county government. Then they brought in the developer, the Southwest Housing Partnership, saying, can you help us solve this problem? And so it really was all of these actors in the community working with this nonprofit developer to lay out what's this building going to have? What sort of spaces will it have? Will it have clinic space in it? Will it have community space in it? And also, were the policies of the nonprofit developer, the rental policies, ones that will work for this population of people that have difficulties getting through life? So all of that had to come together to get this thing supported and getting an application to our state government. So the property itself, again, 30 apartments, so a little over $6 million, so a little over $200,000 per apartment. So it's pretty expensive stuff. But it's built to last, and it's built to last for a population that, is, again, some people with some challenges, and also a lot of clinic space in it and other things that add to the cost. Our whole state budget for the housing is committed to this one project. So $2.7 million after the $300,000, the 10% for the state to administer it. Then also there's another big chunk of our state's home dollars in it, and then also 4% low-income housing tax credit. So a lot of people says, oh, you can't do 4% tax credits in rural communities. Well, this is bringing in over $1 million, almost $2 million in investor equity into making this project work. No debt at all. And then also there's some state funding called group residential housing that comes in to provide rent assistance to make sure that people who have extremely low income can stay in this place, and also the building will operate efficiently. As Jenny mentioned earlier, this is all funded through our state, and it's one where applicants go in, they don't apply for money for the Housing Trust Fund. They have a community need here, so they apply for money to get that need met. Then the state does the job of matching the funding source that works for that particular project in a particular community. There was, you mentioned also in terms of operating support. Well, in this one, they had to use state money for operating support. Minnesota is applying and trying to work out something with HUD in terms of using its full quota, the 1/3 money that can go for operating support. And there's some hooks on that we can get into if people want to ask about that later. But essentially here that we have a property that is really, it's not just housing, but it's how we take, but it's real money leading to housing and meeting the needs of a community and the population in that community that needs support. And that's the story we're telling here. It's not just this is money for housing. It's money to help people within communities. And as I think about this, way back when, our state housing commissioner was pretty darn cool on this whole idea of the trust fund and what it might be, even though Keith Ellison is from Minnesota. But once they saw, also in light of other money going by the wayside being lost, once they saw that they could actually get this money from HUD, and it's $3 million, which still is a little bit of money, in a good way, and use that money to fund something that's really important in a community, well, it's turned her and a lot of the staff from the state at the State Housing Finance Agency around to being advocates for it. So I'm hoping that we can take that momentum in this great project going on in St. Peter, Minnesota, and the story of that community to help build the Housing Trust Fund and bring in other resources so we can really take this story and multiply it 1,000 times.
Thank you, Chip. I'm told that Jim needs to use the hand mic, whoever's got the hand mic. So now you can play Phil Donahue, Jim.
Great. Good afternoon, folks. Jim Yates from the Technical Assistance Collaborative. So TAC worked with, funded and supported by National Philanthropy, did an assessment of the draft housing plans, housing trust fund allocation plans in draft form in the late summer and early fall of the year, working in collaboration with NLIHC staff and Ed is the lead and Paul. And really what we were asked to do was to mine some pockets of innovation, understanding kind of where we're at with a new program being kind of launched nationally, to kind of both for input for the philanthropy themselves in terms of their lending potentially, as well as to really get some feedback out to the field for the next round of advocacy and kind of that feedback loop that you can have in conversations with your state planners. So what we did was take a look at all the draft housing plans, initial screening, and identified 15 that had some innovative practices and potential. Out of that, we did a deeper dive with 7 of them and had individual conversations with folks. Out of those, we looked at and wrote up project profiles on 4 states, Florida, Mass, Minnesota, and New Jersey, as well as identified some innovative aspects with the states offered below. Some trends, I just want to give you a little bit of kind of what we saw. So some of the environmental factors that Ginny mentioned and talked about, as well as the kind of just it being a new program, the limited amount of funds really did impact kind of state policy makers' kind of decision making, and how much energy and how much time they spent on the development of the plans. And I think that was a recognition that definitely came out within the conversations we had, as well as the understanding of we're still within the interim housing trust fund rule, and I think it bore itself out, especially in the operating piece, that folks were interested, and there was a lot of interest from advocacy communities about operating, because just the limitations of operating assistance out there. But folks really kind of said, let's generally have a wait and see attitude, and I think that's where it's coming as you provide the additional guidance and there's more feedback, and we have a few states kind of dip their toes in the water. I think over time we'll see more of that because of that need. So in this environment, it was pretty much a wait and see attitude with basic conservative strategies, looking at integrating funding mechanisms for efficiency sakes as well as leverage, looking at overlay with tax credit at home or all three, looking at vehicles like Ayana's that had an established permanent supportive housing around. We had 5 states, as we mentioned, that acknowledged within their plan that they were or that they proposed to do operating. We'll see if that actually comes out in the plans. I think it was more of a menu within the draft plans that they said they would consider it. In having discussions, more detailed discussions with the staff from Minnesota, who was probably of all the states that we talked to, they were the most interested and most committed around the operating assistance. And I know they had some detailed conversations with HUD staff around it. And I think that next year they'll be successful in that. I think that the timing just didn't work to kind of work out the bugs, given we were in an interim rule period to be able to make it work. And I think as you get those groundbreakers within the operating, you'll see more of that. And I urge you to have those conversations with your state folks. We also saw some states look at really kind of trying to reach down deeper, not just looking at 30% of AMI or ELI levels, but recognizing whether it's supportive housing or folks with disabilities or folks on SSI, that we really did need to get the rents down to 20% levels to 18% levels. So from the 15 states that we looked at, there were a few states in particular that did that, Utah and Florida, and provided incentives. And there was a number of states really looked at aligning their state policy goals, whether it's access to service providers to make referrals to those ELI units created in Florida, alignment with permanent supportive housing initiatives within Massachusetts and Virginia, some of the rural states really looking at targeted rural development, others aligning it with their state homeless planning or their own state community integration work in the cases of Virginia, North Dakota, and Nebraska. Spend a little bit of time on Florida. So Florida did really took a look at their, I think it drove by, they actually did an assessment of their tax credit portfolio, their existing portfolio, and what the rental units looked like, and really only 44% of the current portfolio, existing portfolio, reached down to SSI to 22% to 20% levels of affordability, that deep affordability that they needed. So there was a need that they established. So they, based on that need, they really did focus within their RFP and their incentives to encourage deeper affordability. Other kind of key points from within Florida, they did offer that linkage incentives to that referral network of special needs and supportive service providers to provide those referrals to those SSI level units, as well as they expressed some openness to pursue an operating approach over the long term. The last piece, they looked at creating incentives to have developers and owners reduce their tenant selection barriers to access, and looking at their tenant selection plans to look at criminal justice, limiting the amount of reach-back period that the owners would make, to really create some incentives to reduce those barriers that that have been a discussion point over the last couple of years. So New Jersey, a couple key features. Their targeting was to the reentry population to create some targeted units and targeted resources for that. They also look at going beyond the 30-year affordability time. And then lastly, they targeted communities in high opportunity areas, really trying to reach out into areas that they traditionally didn't develop. And then finally, here are some last promising strategies that came up. I'll let you read most of some of them, but you know, they go from traditional community development approaches of transit-oriented development or to universal access, all the way down to leveraging as well as green development. And that's all I have.
Thank you, Jim. I'm going to look at Paul. Okay, we got time for 2 questions. Vic and this woman right here. Hang on a second.
Oh. I was curious, in those cases where HTF was used for operating assistance, how that was done, what assured continuity over time, and so on.
So what we looked at was the draft allocation plans. We didn't actually look at implementation, and I think where it was at was I don't think we're going to see operating assistance used in the first year. I don't know if Ginny can kind of speak to that, but I think that, you know,
that was not our takeaway.
that was that.
Not our take. We do not believe that we're going to see operating assistance.
Okay, so we're in agreement that they chose as part of their draft allocation plans that they may consider it, but it was kind of more of a menu. And then I think the state that was most interested was Minnesota, and I think that they identified some barriers that they're going to work through to do it next year.
Yeah, if I could just say a word on those barriers. And Ginny should respond, but what I was told is that in operating assistance that it couldn't be used for property managers, the property management staff, or in supportive housing, the desk staff and that sort of thing, that there's sort of limitations within the rule or something that restricted what that would happen. But the goal of Minnesota is if we keep it $3 million, is that there would be a $1 million set aside in the coming years or whenever it could work, and organizations would apply for operating assistance directly.
So that's accurate. So when the rule was written, we took an operating assistance definition from an FHA program, and it does not, so there are certain elements of property management that are covered, but not, for instance, a property management fee. So that is a problem. You know, it's something that we talked about with Minnesota. You know, we think that there's certain things that can be addressed through a waiver if necessary. The other thing that Minnesota wanted to use operating funds for, and which we were clear they could not, was supportive services. So the service money has to come from elsewhere, but there are probably things that we can do before and up until the point where we do our final rulemaking to address any specific issues related to the operating fund language in the rule.
Thank you. I'm seeing waving from Paul that we have to stop the questioning now. I can blame everything on Paul. Thank you very much. And if you have future questions, I mean, come on up and talk to us. We'll be happy to try to answer them. I want to thank the panelists here. Thank you very much for